Hi everyone, I'm Steve Main here with Dr. Nario. Dr. Nario, as most of you know if you've been watching, is with Biointegrative Health Center in Reno, Nevada, where you know that I go and do all kinds of fun treatments. I'm like a kid in a candy store there with all the different drips I can do. I'm healthy, nothing, I'm not treating anything or doctor's not treating anything. I just like to go get drips. So they're in Reno, Nevada. You can check them out online. Thanks for being with us, Doctor.
Hi, Steve. Thank you for having me again. Always a
So
pleasure.
we're going to talk about something that's really popular right now: weight loss drugs. And they're drugs slash peptides. And I know that you use them in your clinic. So just discuss a little bit, maybe the benefits, the dangers um, of what these things are.
Right, Steve. Well, this is the magic pill that everybody wants nowadays, but I always tell them it's not, and I'll explain that in a bit. But of course, not everybody's going to be a candidate for this. So, of course, candidacy for weight loss medication should meet certain requirements like lack of weight loss or inadequate weight loss after 6 months of lifestyle changes, and if a BMI of 30 or greater, even higher, or like morbid obesity, as we call it, which is actually leading to health conditions like diabetes, pre-diabetes, and hypertension. So, as you can see, these criteria needs to be met before you can actually give them the prescription medicines. And they're over the counters, right? But I want to talk about the ones that we do, which are prescription based. So the famous ones like phentermine, I'm sure everybody heard about that. That's almost like an amphetamine like substance, and it reduces your appetite and stimulates the brain to definitely not eat, and which has a side effect of increasing your heart rate and blood pressure. That's why whenever this is being used on patients, make sure that you check the heart, the thyroid, and even glaucoma. And the effectiveness of phentermine for 7.5 milligrams, at least 5% of the body weight that is going to be lost. So remember these percents as we move forward. The other one that's famous out there is Senecal. And this is also the one that decreases absorption of fat and thus being eliminated in your stool. And this is now also producing 5% of weight loss in relation to when you use it. Common side effects is when you poop, it's smelly because the fat is there. You now probably have diarrhea, and the stool floats in your toilet, right? So icky. So this is a little messy in terms of weight loss. And of course, the risks would be if you want to absorb fat soluble vitamins, you can't because you're spilling it all out. So you could be basically a fat soluble vitamin
Hmm.
deficiency is part of that, which is ADEK. So we give these patients these supplements when they use Senecal.
Okay, so I know that Ozempic is a popular one, and so there's some drugs and there's some peptides. Peptides, I'm a huge advocate of peptides. Peptides are just amino acid chains, short amino acid chains. Even I know that. But how do and I got so many questions because I heard you mention diabetes. This seems like this would be a benefit for that also. But how do these drugs slash medications slash peptides, how do they work?
Right. So, Steve, this is the new trend now in weight loss. The ones that I mentioned a while ago were old, and this is the new one. And again, as I can vouch for it in my practice, one of the more effective ones that I have seen. So it can be semaglutide is the generic name. It can be named as Ozempic, Wegovy, and it's a weekly injection, and it reduces the appetite of the patient. That's why they're losing weight, and it activates their brain in relation to also appetite regulations. So it's what we call a GLP-1 agonist. And GLP-1 is produced in the small intestines. It helps the pancreas to release insulin, and it lowers the blood sugar levels. That's why this medication was originally made for diabetes to treat it. And also, GLP-1 agonists inhibits the hormone called glucagon, thus preventing glucose or sugar from going into the bloodstream. And also, it's an incretin mimetic. I'm throwing out jargons here, but This is just another hormone in the body that actually increases insulin production, thus lowering blood sugars. And again, the GLP-1s or the semaglutides is not only healthy for losing weight, but it also helps with heart health and kidney function. And so here's the percent that I was going to tell you. The percent of weight loss is 14.9% of body weight that is being lost compared to the other ones that are 5%. So when I mentioned to you about a while ago when you were asking me what's the function of Wegovy or semaglutide, it slows down also the movement of your GI tract. That's why the slowness is making that appetite suppressed. The GI tract thinks that there's still food in your in the pathways. That's why you're not going to be asking for snacks or meals that you're getting for 3 times a day. Sometimes my patient just eats one meal a day, and thus the weight loss.
So yeah, it makes sense it would work for diabetes. It's just so fascinating. So what happens if someone takes this and they have a lot of weight to lose and they lose it? Can they come off of this and usually maintain that weight loss? I know they have to change their lifestyle because if they go back to
Right.
eating the way they were, they're going to go back to the way they were. But have you seen success? Can people have success getting down to a healthy weight and then getting off of this?
They can. The thing here is you're right. It's almost any type of weight drug. It's not only Ozempic or Wegovy. This is a problem for any weight loss drug that patients gets dependent on it, and when they stop the medicine, they actually now go back to their bad habits, thus blaming the medicine for failure and telling I guess everyone that hey, it didn't work. I got the weight back. But the problem here is they're not focusing on the real issues. I always tell my patients that this is only a time frame that we're given when we use these types of medicines to instill the good habits of lifestyle, exercise, and diet. So that will always be the key. It's not the medicine. Especially for this type of medication, I only want this to be used for a certain period of time, like max 2 years, because there are certain risks that I will discuss later on. So that's why this is not the ultimate therapy. It will bridge you to that ultimate therapy, which is actually instilling those 3 pillars of real weight loss for patients.
So, in your clinic, who's a candidate for this? Someone who's obese, I would assume. Someone who's diabetic, I would assume well, obviously it helps. So, who are the people that should really consider this?
So, as I mentioned at the when you're with your first question, Steve, the criteria it's the same. Anybody who meets the criteria that I just mentioned for weight loss is a candidate for this. But here's something that people don't know where new research came to be in relation to semaglutide and Wegovy on what they can bring to the table. So anybody who also has cardiovascular problems like high blood pressure, high cholesterol, these are actually effective to lower these cholesterol, triglycerides down, and even lowering down blood pressure. So it increases nitric oxide, and even people who had like strokes and heart attacks, and even lowers down the size of the infarct or the damage of the heart and also the brain. And here's the thing: what I like about this also is neuroprotection, brain protection. Studies have shown it lowers the inflammation of the brain, improves the branching out of neurons and nerves, and even mitochondrial function of the brain. It prevents memory loss, potential effects even being tested now in Parkinson's and Alzheimer's. And then also muscle loss. People are always saying semaglutide makes you lose muscle. On studies, it actually prevents and increases muscle. It actually makes it go up and even have gains. So that's why lean body mass is preserved and even sometimes sustained. So these are the things that people don't see about semaglutide. That oh, it's only for weight loss. It's really not. That's why it's a magic peptide that you can actually use for different problems.
So, is do most of these positive gains come from because people are eating less, um, or is it a combination of they're eating different and they're eating less, or is this medication actually doing something in the body that just improves all those things you just mentioned.
So you're correct, Steve. Those are two factors that are actually present in semaglutide. You have to remember when you lose weight, there's so many things so many good things that happens, right? Just you can exercise now better. You can just feel better. You're just a happier person when you lose weight. You can go out there and be social again. And at the same time, we have receptors in our brain that are being activated by these GLP-1 agonists and the heart and the blood vessels. So they're all over the place. That's why it was just the focus of social media, the focus of commercialism. It's all about weight loss. But the thing here is, as doctors, we look into these deeper things that they do act in different organs, not only for weight loss.
Okay, so what about, because you mentioned you don't like any of your patients to do this for more than 2 years. You said 2 years max. Are there side effects, or what is some of the downside of these peptides?
Right. So, Steve, you're correct. The side effects is the one that really makes people fall off of this. And may it be Wegovy or Zempic, just plain semaglutide. As I mentioned to you a while ago, it slows down the movement of your GI tract. So, if you're going to be eating when your body still has food inside, you're going to have nausea, and worst cases, vomiting. This is again because of the effect of the slow movement of the GI tract. But here's the thing: we have natural ways of negating the side effect. So we use what we call vitamin B6. It's known to suppress nausea and vomiting. We even use BPC 157 to hold that down. That's another peptide. And the most effective one that I've seen is ginger. So when you eat sushi, make sure you put it in a bag, take it home with you if you don't want to get ginger from the store. But even slice ginger up and cut it in little pieces and put it in there when you feel nauseated when you're using semaglutide. Very effective. And that's why most of my patients stays on it and has a higher compliance compared to the other ones who are not using that method. And when I mentioned to you about 2 years, the reason for that is if you use this longer, again, the studies has not proven this much, but there is still evidence that people, for example, are not supposed to get this when they have a family history of medullary thyroid cancer, for example, or if they have a personal history of medullary thyroid cancer, and also the condition called multiple endocrine neoplasia too. So that's why we do a thorough history. It's not for everybody because you can worsen these things if you take them for a long time or if you do not check your patients thoroughly for these specific issues. And another one would be pancreatitis. So pancreatitis is something that I have seen in a patient of mine. That's why we check for blood work, for example, amylase lipase, or even a history of alcoholism or them having pancreatitis in the past. Kind of puts you on the guard and may it even be a contraindication for it. But here's the thing, though: weight loss programs again helps patients. The most successful weight loss so far is again that I've seen in my experience in my practice is this one. There are new ones out in the market. It's called tirzepatide also or Monjero. But that's also another discussion for another day. But it produces more weight loss, more benefits than semaglutide, and less side effects. I like to use only again for limited period of time, even for this new one, but always a reminder for our patients: this is not the true treatment. The true treatment is learning the three pillars of lifestyle, exercise, and diet, as the medication works in your system and buys you time to instill those good habits.
Yeah, well, that is great information, and just great stuff that you're giving us, Doctor. We appreciate it. That's Dr. Nario at Biointegrative Health Center in Reno, Nevada. Thanks for being with us.
Thank you, Steve. It's always a pleasure to be here. As we all know, that knowledge is power, and thank you for letting me provide you with that angel longevity and health maintenance, which I call the biological edge or the bio edge.
Hi, everyone. I'm Steve. If you guys like fitness and health tips, especially for people over 50, please subscribe to the channel. And we do interviews with nutritionists, personal trainers, and so on. I'm a health club owner. I own multiple health clubs, multiple different business models. So please subscribe if you like this stuff. And you can hear some of the interviews and so on. Now, today, I'm going to tell you how to buy peptides. Not only how to buy peptides, but where you can buy peptides and um, where you know that this is a safe product, because these peptides, or there's coenzymes. I buy NAD here also. The company is Invigor, is the name of it, Invigor Medical. And if you use the promo code Vitality1, that's Vitality, the number one, you will get $10 off whatever you buy. Now, here's what I like about this. And I've been buying and buy peptides and different compounds from Invigor. I've been doing it for many, many years. I trust them because I get the compound. There's a prescription written for me. They evaluate it. It's very quick and easy. Just a simple little questionnaire, but a doctor will approve this and write the prescription. Then, very important, the medication or the peptide or whatever you want to call it, whatever you're buying, will come from a compounding pharmacy, a legitimate compounding pharmacy. So you know that this is a legit substance. It's not just something you're buying online and you don't really know what's in it, because these are licensed physicians and compound pharmacies that can send this to your doorstep, most doorsteps. So check out the link in the description and use the code Vitality1. You will get $10 off. And more importantly, you can trust this. And again, if you guys like to hear about different vitamins and supplements and so on, and what I'm doing, what my protocol is, I'm over 60. Please subscribe to the channel, and just love to hear your comments with this, any product that you decide to buy there. Love to hear your comments. Put questions in the comment section, and keep me posted, because I'm really excited about this. I wouldn't mention this, or I wouldn't promote this if I wasn't using these peptides and if I didn't really believe in them. And it's something that I'm excited about because it's been a life changer for me.